Will Humble is the director of the Arizona Department of Health Services and has more than 25 years of experience working in the public health sector, 20 of those with the Arizona Department of Health Services. Mr. Humble is responsible for one of the largest state agencies focusing on communicable disease control, public health emergency preparedness, emergency medical services, environmental health, the licensing of healthcare and child care facilities, laboratory management, and public health prevention programs. Mr. Humble is an Arizona native who received his master's degree in public health from the University of California and a bachelor's of science in microbiology from Arizona State University and a bachelor's of science in business administration from Northern Arizona University. As director, one of Mr. Humble's goals is to encourage all Arizonans to improve the decisions they make about food and exercise. He is an advocate for eating the right amount and the right type of foods and living an active, healthy lifestyle. And so we'll hear from Will Humble now.
Good morning, everybody, and thanks for inviting me here today. I really appreciate the invitation. This is a really important topic. This has really been one of the primary focuses, that I've had at the department since I got here, because I looked at all the areas that we're responsible for at the department and said, what are the most acute problems that we have in Arizona, and what are those areas where I can actually make an impact? And when you put those two things together, childhood nutrition and working on this epidemic with childhood obesity are right on target. Now, why is that? A, because we're right in the middle of the biggest recession in a long, long time. Our latest survey shows that 77% of families run out of food before the end of the month. So we've got an acute hunger problem. At the same time, we've got an obesity epidemic across the whole demographic of Arizona, and in particular within our population of kids in Arizona. We're fortunate that the nutrition programs in the state of Arizona are essentially federally funded, which gives us an actual opportunity to do something about childhood hunger and improving the nutritional status of kids in Arizona. As Neil mentioned, it's been really challenging times working for the state of Arizona with the budget reductions that we've had. Bottom line is our general fund reduction at the Department of Health Services has been reduced 47% over the last 2 years. So obviously, to do something with state funds right now is very challenging. But we're fortunate that the USDA and the federal government doesn't require a match for our nutrition programs. And so that gives us an opportunity to really make some progressive changes throughout the state with our nutrition programs. And so one of the things that I'd like to talk about today as we move forward with our goals of ending childhood hunger is to keep in mind this obesity epidemic that we're facing across the country and here in Arizona. As we continue to address childhood hunger, we need to make sure that we're paying close attention to the obesity epidemic at the same time. And as we move forward, we're going to have some policy decisions over the next few years to really have an opportunity to make a difference in that. Let me start with probably the biggest opportunity that's at hand right now is the reauthorization of the Child Nutrition Act. And if you go to the Senate website, it's been passed by the Senate Agriculture Committee, you can see a really good element within that new bill, which essentially would charge within 90 days the USDA to come up with a way through the child breakfast and lunch programs to set forth some better nutritional criteria for those breakfast and lunch programs. And it goes right back to that issue of childhood hunger, not just being about hunger, it's about nutrition. So as we press ahead and as the Child Nutrition Act continues to move through at the federal level, I urge you to use your stakeholder groups and yourselves to communicate with your legislators about the importance of making sure that those nutritional standards continue to be in the bill. Now, it's true that more nutritious food often costs cost more, because the cheap processed food is one of the reasons why we have such an obesity epidemic here in Arizona and across the country. And so one of the elements that we really need to take a close look at is whether or not there's adequate funding within the Child Nutrition Act as it currently exists to make sure that the schools can actually deliver those more nutritious meals at a cost that they can afford. And so I urge you to work with your stakeholder groups over the coming weeks, and maybe not even months. This could be moving very quickly, to make sure that we're in a place for advocating to make sure that schools can actually afford to deliver those more nutritious meals, because the last thing we need is to have greater and more aggressive nutritional standards for the lunch programs, and then have schools say, we can't deliver that food for that price, and have schools drop out of the program. So we need to keep our eye on this issue of nutrition, and at the same time make sure that there's adequate funding so that the programs can stay intact, and that we in fact gain schools participating in the program and don't lose any. So that's one of the things that's happening right now. And another thing that we ought to talk about today, and we really need to establish this dialogue now, so that we as a group of stakeholders here in Arizona and across the country have the opportunity to really weigh in 2013 when the Farm Bill comes up for reauthorization, because that's the point at which we get to make some decisions nationally about what's the direction of the SNAP program, what's the funding inside the SNAP program, and what are we going to do moving forward in terms of setting some nutritional criteria on the SNAP program. Now, I've talked to audiences before about setting some kind of nutritional standards within the SNAP program, and it's surprising that I get really sort of mixed responses, even within the public health community that is really concerned and charged with doing something about this obesity epidemic. And it really boils down to this: we've got to give families the ability to make better choices for using their SNAP benefit program, so that they're buying more nutritious foods, not just calories. And that means it's kind of the things that we're working on at the Department of Health Services through the SNAP education program through Care and Cells Group, which is helping families understand, for example, what vegetables are in season here in Arizona when, and those are the times where you can actually afford to buy those vegetables at a reasonable cost, and then finding recipes to help families use those vegetables that are in season and at low cost to help feed their family and get nutrition into their kids, not just calories. And so part of this is really an educational effort, and honestly, I think part of the dialogue at the national level has to really be around, do we really want the SNAP program moving forward to be open to all of these processed foods? Now, it's a controversial topic, but it is something that we really need to talk about, because child hunger and food insecurity and obesity are integrally linked. At first glance, it's not an intuitive link between food insecurity and obesity. These people might think, well, if they're obese, they're just eating too much. Well, that's not it. Food insecurity and obesity are tied hand in hand. They're completely interlinked. When a family is food insecure, they end up buying cheap processed foods, and when kids are hungry, just like you and I, when you skip lunch, what do? You go home and grab the pita chips and eat a half a bag. It's the same thing with families who are food insecure. They make unhealthy choices when they're super hungry. And so we've got to do something about making our SNAP programs more in tune with today's public health issues, which are not just childhood hunger and food insecurity, but obesity as well. So, with that, thank you all for coming, and I can stay till about 11:15. So, Carousel, I know you're going to do some presentations later. We got a dynamite staff at the department, and like Neil said, we're doing our very best to make sure that we work in a collaborative way with the Department of Economic Security to make sure that we really maximize the use of those federal resources that we're so grateful for, because we wouldn't have a health department if it wasn't for the federal government, and you wouldn't have DES. Thank you.